Uh, Hello, this is my practical video submission for case study number 2. This is Jane, and she's preparing to run the comrades in 9 months. Okay. We're going to start off by taking my client's blood pressure. She is currently 65 years old and does Pilates about once a week and preparing to run the comrades. Okay. Systolic blood pressure is 130. And diastolic blood pressure is around 80. Her blood pressure is a little bit high, but normal amount. Client's resting heart rate. She's been resting for 5 minutes, and we're going to take it on her wrist. So she got a resting heart rate of 35 for 30 seconds, so now we're going to times that by 2. So her resting heart rate was 70 beats per minute, and that is average for someone her age. We're now going to take my client's height and weight. So she's going to step onto the scale to her right. My client is currently weighing 58.2 kilograms, and now we're going to measure her height. My client's height is 157 centimeters. Now with that, we're going to calculate her BMI. Okay. Waist to hip ratio, we're going to start with the waist. So you can just her waist is currently at 82 centimeters, and her hips, you take from the large area. Her hips are currently 97 centimeters. Now with that, we're going to work out her waist to hip ratio. We're going to be measuring the client's body fat percentage using 3 skin fold measurements found in the NCSA textbook, and the 3 measurements are from her tricep, her suprailiac, and her thigh. Okay, so if we can stand like this, bend your elbow at 90 degrees. Now we're just going to pinch and measure to the click. That came to 20 millimeters. The second skin fold is the suprailiac crest, so I'm just going to ask my client to lift her shirt, and the measurement came to around 8 millimeters. Now the last one for her thigh. Just going to pinch. That came to 20 millimeters. Now we're going to be assessing my client's posture. Okay, so assessing the client's posture, her earlobes seem to be level, her shoulders, her left shoulder is slightly higher than her right shoulder. Her iliac crests, her right iliac crest lies a little bit higher than her left iliac crest, which may be due to a shortened quadratus lumborum on the side of the higher lying crest. Now if the client can turn 90 degrees. The scapulars are lying flat against the thoracic wall. Now if the client can turn another 90 degrees. The spine seems to be straight. The graded trochanters are level. Now if the client can face back to me. The ear and the eye are in the same level. And now if the client can turn again 90 degrees. And she has a normal S-curve spine with a little bit of slight lumbar lordosis due to tilting of the pelvis. But all in all, her posture is good. Okay. Now we're going to be performing the goniometer flexibility test. So the center of the goniometer stays on the joint and the moving arm follows the bone that is moving. Moving it up so that it is in line with the bone, and it comes to about 53 degrees. Now we're going to be doing the shoulder flexion. So the client's going to move her arm up above her head, and this stays on the joint. That is nearly perfect. About 170 degrees with hip extension, and the client must keep her hip bone on the mat. Around. Okay, perfect. And the client's hip extension is about 20 degrees. Hip flexion with the bent knee. Okay. Okay, bending your knee and lifting your hip. Keeping to the bottom. Perfect. Hip flexion with the bent knee comes to 80 degrees. Hip flexion with a straight leg. Okay. Okay, that comes also to about 80 degrees. Okay. Now ankle plantar flexion. The norm for this test is 40 to 45 degrees. The client got 40 degrees plantar flexion. Okay. Okay, 40 degrees. Okay, left ankle dorsiflexion. Okay. Okay. $50 degrees. Now ankle plantar flexion. Okay. $30 degrees. Okay. We're going to perform the sit and reach test to examine the client's hamstring and lower back flexibility. So we've placed the measuring tape on the line here, and she's just going to reach forward as far as she can. So that comes to about 25 centimeters, which is below average. So her hamstrings and her lower back must be quite tight. Okay. Now we're going to do the step down test. This is a test to assess the stability of the foot, the knee, if it moves medially, laterally, or tracks over the tibia, the strength of the quad, and if the ACES remain level. So the client's going to place her hands on her hips, take one leg off the step straight, and bend at the knee slightly, and perform this for 10 repetitions. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now we're going to be performing the star execution balance test. You start off by standing in the middle of the 8-point circle, and we're going to start by going this way. And you have to touch the end and bring your foot back to the center until you've reached the other side. You stay balanced in the center for 1 second. The test is discarded if the client loses balance, places her other foot on the ground. Yeah. Now the other foot. Yes. Okay. Los tienes que hacer con los dos pies. Hmm? Well done. Okay, the final assessment is the vertical jump test. So to test the muscular power, and we've placed the piece of tape as high as the client can reach, and now she's going to jump, and we're going to measure the distance between the tape. Okay? Okay. I've got. Yeah. Okay. Now we're going to measure that distance. So it's 24. Perform the muscular endurance test with the curl up test. We're gonna do it for 60 seconds. Okay, go. Okay. Perform 3-minute step test, which is a VO2 max test, and because the client is a woman, the beats per minute that she's going to walk to is 96 beats per minute. To the beat. Yes. Okay, the client has just finished the 3-minute step test. Now we're going to take her heart rate for 15 seconds and then multiply that. Okay, 35 times.
Starts with a triple bleep after a 5-second countdown. 5, 4, 3, 2, 1.
Bien. Nice. Okay, remember to breathe. Bien. Yeah, go.
Start of level 2.
Okay. Now we're going to be performing some of the exercises from the program. And the first one is an upper body strength exercise, which is elevated push-ups. So you want your arms shoulder width apart and palms on the table, and you're going to keep a hollow body, keep core tight, and bend at the elbows so your chest or stomach touches the table. Okay. And this is an easier variation of the normal floor push-up for people who struggle with these kind of exercises. Okay, this is a lower body exercise that is going to help the client in her running as it strengthens the shin muscles to prevent shin splints. So to perform the exercise, you place your back against the wall, legs straight with a little bit of a bend in the knees, and you're simply going to lift the toes till you're on your heels. The final exercise is a core exercise, which is important for running. So we're going to perform a plank. You start by placing your elbows shoulder width apart underneath your shoulders, keeping a hollow body and a straight spine. Push your scapulars away and tense the core.